Well, welcome to Focus Today. Always a delight to have in the studio Nisha Jackson. She heads up the Ventana Wellness, but today's a very special day because all of the month of October has been the Breast Cancer Awareness Month. And I have to tell you, Nisha, I'm watching the NFL games, right? Tough guys out on the field, right? Killing each other, and they got pink on. They had pink gloves, they had pink socks, even some of them had pink shoes.
It is amazing how publicized breast cancer has gotten.
Pink cars and pink trucks, and it's really a great awareness program.
It really is. You know, everybody is participating in it. Our clinic even participated in it, and that was a good thing, everybody wearing pink. I'm sorry I'm not wearing pink today. I should be wearing pink. It's the last day of the month. Mm-hmm. So I think that the information that people are getting out there is good. I was hoping that today I would be able to give some more information that the general public is not hearing, more about lifestyle changes that would reduce your risk for breast cancer.
Well, I'm glad you're talking about it because it's, in spite of the pinkness of our culture, the problem is still there.
The problem is still there. And you know, just a little bit of a side note, about 200,000 new cases a year for women are diagnosed with breast cancer, about 200,000. But it also happens for men, about 1,700 new cases a year or more for men each year. So that's pretty significant. It's not just a female disease, although it's predominantly female because they're set up to get a little bit more of a hormonal imbalance in the breast area, which can predispose them to breast cancer. So, and I think that that's one of the areas that I'm hoping research focuses in on more going forward, is the hormonal imbalance that women can have and men can have, especially since we live in such an estrogen-dominant society, that estrogen makes the breast tissue more stimulated, or makes it grow more. And that's not a good thing when we're talking about keeping the breast healthy and at a lower risk for breast cancer. So I think that's one of the areas that we really need to talk more about, and how women can protect themselves, even from a very early age.
All right. Screening, there's different types of it now, and how often, at what ages, and all of that?
That's so confusing, Perry. So many people today don't know whether they should get a mammogram. Women once a year, every 3 years, every 2 years, and women often just kind of, they're on the internet reading information, or they're reading magazines. It used to be after the age of 40, you should get a baseline between 35 and 40, and then after the age of 40, you should get a mammogram about every 1 to 2 years. But then they changed the recommendations this last year and said that you only need to get a mammogram about every 2 to 3 years after the age of 40. So it really depends on your risk. If you have a strong family history, you're overweight, you don't exercise regularly, you're a smoker, you're a heavy drinker, these are some of the risk factors for breast cancer. You probably want to get screening more often, or if you've had an abnormal mammogram in the past. So, and mammogram's not the only way that we can screen for breast cancer. There are other ways that we can screen, and we probably maybe should talk about that too.
Go to the airport and get a mammogram, can't you?
That's right. Just walk right through the screening.
Well, save your few bucks. No, all right, so what are some of the other ways?
So mammogram obviously is the traditional standard screening method for breast cancer, but there's also another way that you can check for breast cancer, and this would look more at the heat generated in the breast, which is one of the very first signs of something that's abnormal. And this could be anywhere in the body, but the particular test is called a thermography, and it's starting to be used more and more in the United States and also in Europe. Thermography is a screening for the breast that detects, is an infrared screening that detects heat in certain areas, which may be something that could be developing. So it would be a very early sign.
Wow.
So many women now are choosing to do thermography along with mammogram. It doesn't replace mammogram, and I think that's the confusing thing for women, is they say, oh, well, that doesn't give me any radiation, so I'm just going to get a thermography, the infrared screening, instead of a mammogram. But it doesn't change, it doesn't replace the mammogram. They're looking at the breast in two totally different ways, and they're picking up two different abnormalities. So the thermography is the infrared screening, so it picks up heat, but it doesn't pick up calcifications, which is what the mammography picks up. Now, there's another type of screening that you can get, which I think it's really more reserved for women that have very dense breasts, have, again, high risk factors, have had a previous abnormal mammogram, or they just want further screening. Maybe they've had a couple of abnormal mammograms and they want something to be a little bit more accurate. They might decide to do an MRI of the breasts. That's more expensive. You have to be pre-approved with your insurance company. So, but MRI is the way to go if you've got some confusing things going on with the breasts and you're more high risk.
How are the insurance companies looking at mammograms? Is this a preventative thing they encourage?
As far as I know, because there's so many different insurance policies out there, most insurance companies are covering routine screening for mammography. More and more insurance companies are covering this thermography that I was just telling you about, the infrared screening. And then there's also one other way to screen the breast, and that's with an ultrasound. And again, this causes so much confusion with people because many women think that I'll just get an ultrasound because, again, it's not radiation, and the ultrasound will replace the mammogram. But again, it doesn't replace the mammogram. The ultrasound's looking more at, let's say you have an abnormal breast lump. The ultrasound would determine, is that a solid lump or is that a cystic lump? So is it fluid filled or if it's solid? It's not, again, going to pick up the heat in the breast or the calcification. So I know this is frustrating because why can't we just put all of this together and have one really good, inexpensive screening? But we don't have that yet. So again, it needs to be addressed individually with each patient.
Now, finding any kind of a lump, you want to have it checked out, but they can somewhat be deceiving. I think I remember you one time saying that some of these lumps may be a cause of too much caffeine.
Yes, there's so many factors. I wanted to just mention this because I have found this to be very interesting over the years. I've been seeing women now in the office for 20 years, doing breast exams on them, gynecological exams, asking them questions, diagnosing breast cancer. And the one thing that I always ask my patients who have been diagnosed with breast cancer in my practice is, tell me what happened in your life 7 to 10 years ago. This is upon diagnosis. And inevitably, every single woman that I have ever diagnosed breast cancer on will tell me that within a 7 to 10 year period prior to the diagnosis of breast cancer, that something very significant happened in their life that was very stressful. We know that the average most common breast cancer takes about 7 to 10 years to actually show up on a mammography.
Wow.
And we also know that stress is a very destructive thing for the immune system. So many people are exercising, they're taking care of themselves, they're using the right supplements, but their emotional state is out of control. They're under too much stress, and that causes a reduction in your T cell count or your immunity. It also causes an excess estrogen circulation, which overstimulates the breast. And I just find it interesting. It just seems, Perry, inevitably a woman will say, well, that's when I went through a divorce, or that's when my child became very ill, or our house burned down. Something happened. So I think the take-home message there again about stress is that it's so important, if a stressful incident happens to you, is to immediately do everything you can to take care of yourself. Take care of your immune system, take your supplements, start sleeping as much as you can to rejuvenate your immune system. Get off all of the inflammatory foods, get off the sugar, get off the processed foods, start eating a lot of organic fruits and vegetables, get off of the foods that have too many hormones in them, like the non-organic meats and dairy products. All of these things really help reduce the progression of the abnormality in the breast. And I think you've got to stop it when you're under stress. But as you know, Perry, what happens...
I don't know anybody's not under stress,
What happens is that when we become very stressed, we stop sleeping, we start eating comfort foods, which is sugar and flour and all of those inflammatory foods, and we stay in the stress. We don't wake ourselves up and get out of it. So that's the key, is you got to take care of yourself, especially when something big happens.
So you're saying there's about a 7-year link between a very high stress time and to when it may show up as cancer in the breast.
That's what I have found in my practice, but we know from research that it takes the average most common breast cancers 7 to 10 years to show up on a mammogram. So what I'm saying...
Doesn't show up on a blood test?
No. No, on a mammogram, it takes 7 to 10 years to actually show. So there's this kind of this growing period of time, and I'd just say the message is that if, when I'm just talking about stress, because there's so many other ways that you can reduce your risk for breast cancer, but as it pertains to stress, during a stressful period, and it might be chronic stress, like you said, ongoing financial stress, ongoing home stress or children's stress, whatever it might be, in-law stress. The key is to do whatever you can to take care of yourself. And I just know that the average, most common thing for people to do when they're under stress is they don't take care of themselves. Yeah. They're too busy taking care of everybody else. So I think if we can work on that 7 to 10 year period after a very significant stressful incident happens, that we can better protect our immune system, which then equals better protection to our breasts.
All right. Even though there's huge awareness of breast cancer, and the whole month of October is set aside as the awareness month, what are the numbers? Are we gaining on this problem, or are we still losing the battle?
Yeah, actually, the numbers are staying pretty steady. You know, from year to year, there may be a slight increase or a slight decrease. But unfortunately, there was a sharp increase about 7 to 10 years ago in breast cancer. And I think that that has a lot to do with our detection. You know, obviously, we're screening more women than we've ever screened before. And so I think that that has something to do with why we're picking it up more. The other thing that has to do with the increased risk of breast cancer is our stress. I think our stress has a lot to do with it. Our diet has a lot to do with it. This estrogen dominant, which is why we're seeing men with more breast cancer now, is this estrogen dominant society. And that, a lot of people are like, what does that mean? It means that even our plastics that we're drinking out of that are heating up, this is not a theory. This has actually been shown in research over and over and over again. Yeah. That excessive exposures to plastics causes the body to take in this chemical that is very similar to estrogen. So it overstimulates the breast for men and women. It's why we're seeing men with more breasts, the actual size. I don't know if you've noticed that, but there are men today that have larger breasts than they should have.
The likelihood of cancer above the age of 50, breast cancer, is greater than it is below 50. Is that correct?
Yes, certainly the older you get, the higher your risk is for breast cancer. And this is confusing also for people, because you hear the 1 in 8 women get breast cancer, but it's only if you live till age 80. So all of the women who live until age 80 have the risk of 1 in 8. It's not 1 in 8 over your entire lifetime. Okay. So it's women who live till age 80. So certainly the older you get, the more at risk you are for breast cancer.
On the other hand, I know that's a tad off the subject, but it seems to me that the whole issue of cancer is epidemic.
It is, but I think, I know I sound like a broken record, but I really believe it's our lifestyle. I really believe we're not taking care of ourselves. We're overweight, we're under-exercised, we're not sleeping well at night, we're eating junk, and then we expect our system to work optimally and not ever be predisposed to anything, and it doesn't work. So the genetic factor as it pertains to breast cancer is so minimal. You know, when I first started practicing, we thought that the incidence of genetic breast cancer was about 30 to 40%. Some people were estimating 50% of all breast cancers had some genetic link. Now we know it's about 2%. It's actually very small. So I think it's a lifestyle issue. So that's a lifestyle hormone issue, but those two things go together.
What are some of the major contributors to breast cancer?
So some of the major contributors that you may not know about, one of them is, unfortunately, the longer you use birth control pills and the earlier you start using birth control pills puts you at an increased risk for a very rare type of breast cancer called a triple negative breast cancer. The triple negative breast cancer means that you do not have one of the receptor sites that's most common to fuel the breast cancer, which means that it makes it more difficult to treat. Because we have most of our breast cancers are receptor positive, whether they be estrogen receptor positive or progesterone receptor positive or growth hormone receptor positive. We have chemotherapy and types of treatment that attack those receptors and make it more effective. But this triple negative breast cancer that's very closely related to birth control pills, in fact, they estimate about a 4.2-fold increase in this very rare type of breast cancer the longer you use birth control and the earlier you start. Wow. So again, I think that goes back to this hormone imbalance. One of the ingredients of the birth control pills And one of the ingredients of a synthetic hormone replacement therapy actually causes a downregulation of progesterone in your breast, which does not protect your breasts. So one of the things that I do with my patients that need birth control is to give them natural progesterone in addition to the birth control, just to protect their breasts. So there are ways around it if you need to use birth control or find that that's the best method for contraception. So there's other ways that you can get around that.
All right, so other major contributors, smoking?
Smoking is a contributing factor. Alcohol consumption, the only study that was real relevant as it pertains to alcohol in the breast was more than 14 drinks per week, which sounds like a lot, but there are a fair amount of people that are drinking 2 drinks a night, every night of the week. So I would limit that because, again, the estrogen is stimulated from excessive alcohol intake, and it's not good for your liver. So the key here is the liver is the master detoxifying organ of your body. You want to stay sort of detoxified, right? You want your system running clean. So the name of the game is to keep your liver as healthy as possible, and that's why I say stay away from the junk, stay away from the processed foods, start eating foods that give you good antioxidants like colorful, rich foods, and keep your liver healthy. Maybe get on milk thistle or a liver support supplement, because your liver helps keep your body detoxified, and it also is the organ that helps metabolize your hormones. So again, back to the hormones, keeping you more hormonally balanced. So those are some of the risk factors. Now, some of the research that's new in the area of breast cancer that I find really interesting is we've known that women that have children have some protection against breast cancer. And the interesting thing is one of the hormones that goes that's very elevated during pregnancy is called estriol. It's a very weak form of estrogen, and we can actually give estriol to patients now. And estriol is also another, this is a side note, but it's also a hormone that's being used in trials for Parkinson's and found to be very effective. Wow. So that's just a side note. But estriol is very high during pregnancy, and now research up at Fred Hutchins up in Washington has identified that the estriol levels that are very high during pregnancy create sort of a remaining fetal cells that are present in women for many, many years. In fact, they've detected fetal cells in women up to 20 years after they give birth. Wow. And these fetal cells actually provide some form of immunity for women. They looked at women that were diagnosed with breast cancer that had had children and women that had not been diagnosed with breast cancer that had had children. And the women that had breast cancer, they couldn't find those fetal cells present. So now they're looking at why do some women keep the fetal cells inside their body and some women don't. So that's the next area of research. But
otherwise, that wouldn't be activated unless they got pregnant?
Right, yeah. They're also looking at injecting women with fetal cells that are similar to the fetal cells they would get if they were pregnant, if they can't achieve pregnancy, just to reduce their risk. So that's another area of research. But I find that interesting that something that God gave us is to have children, many of us, and it protects women. Wow. So I like that research. I also think it's interesting that, you know, women are so attached to their children, and you kind of wonder about that bond. Yeah. And now that we know that the fetal cells can be present in a woman for up to 20 years or longer after she gives birth, kind of explains why when children go through something emotional, the mom often feels like they're going through it too.
So when it's 20, that all turns off and the kid leaves the house?
I know. I don't think it ever goes away.
No, that's wonderful. So, a few minutes that we have left, what do we do now to be better? Well, let me ask you this before I get to that. A lot of women who are involved now with breast cancer and they're going through all kinds of treatment, we're finding some of these numbers are very discouraging. And but on the other hand, what can they do if they're in the middle of a chemo program and they're taking all kinds of medication? What can they do to minimize maybe the nausea or the illness?
Well, I think it's really important to talk with somebody who understands supplementation. Michael Altman in our office, his specialty is cancer, and he's a nutritionist, and he works with a lot of my patients that have been diagnosed to get them on an immune boosting program. And also he works with the oncologist so that he can put them on a program that actually helps boost their immune immune system, but also helps with the side effects of chemotherapy and radiation. And there's so many things women can do and men can do, and it's not just breast cancer, it's other types of cancer, that if you're really suffering, reach out and get some help and talk to somebody who understands what you can do to support yourself during this time. I think that that is huge. And, you know, the time that you want to support yourself is when you're not feeling well and when your immune system is very low. But I also think it's important to be protective. We often get into that mentality that I'm not going to worry about it till I have to worry about it. And you really shouldn't have that mentality. We only get one shot at protecting ourselves, and you don't want to wait till you have a problem. So I think the key is, again, taking care of yourself. We know that the risk for breast cancer significantly goes down. Maybe one of the most significant factors in reducing breast cancer is exercise and keeping your body mass index at an ideal range not to exceed about 25. Wow. So healthy weight, regular exercise, and all of those are things under our control, that I think that the message is, don't wait for the magic bullet. Take care of yourself now, because you really do only get one shot at it.
All right, again, just as a little bit of a recap, how early should women start checking for breast cancer?
So I still tell my patients that they should have a mammogram by the age of 40. They should have their initial baseline mammogram by the age of 40, and then about every 2 to 3 years after that. If you want to, you could add in a thermography in between that. And again, it should be based on your own risk factors. Again, if you have increased risk factors or you've had a problem, you might need them more frequently than that.
How many types of breast cancer are there?
There's many types of breast cancer. Unfortunately, that's starting to change too, the types of breast cancer that we're seeing, which is making more of a challenge for the oncologist to treat breast cancer. Wow. The ideal situation would be, Perry, that we really understood the genetic links and the genetic mutations that happen with breast cancer, so that we could go in, and we've done this with CML leukemia. We've identified the exact genetic mutation that happens, so that we can go in with a treatment, a chemotherapy that targets that exact mutation, rather than giving a chemotherapy that just blasts everything. So right now we're still in that shotgun approach. We're not really into let's target that exact breast cancer. And so they're still working on the genetic end of things to identify treatments that would be very specific, so they can knock it out without really blasting the whole system. So that would be the ideal situation, and there's just so much research that's ongoing in these fields that's exciting.
Well, it is. It's an amazing thing, and the problem is big. It's getting great attention, and a lot of people are paying attention to it, and that's good. So I hope that folks will get a hold of you and start living well.
Yes, and get your hormones balanced, and do not go on that synthetic progestin. We know that that was the only hormone in the big hormone study that was linked to breast cancer. It's the only one.
And they never properly took care of that, did they?
They never properly took it. It's starting to come back around now, and women are realizing that the bioidentical progesterone is actually breast protective, but not the synthetic progestin.
All right. Get a hold of Nisha at her clinic, Ventana Wellness. She's got a great team of physicians and people there to test you out. And the website there?
It's ventanawellness.com. That's VENTANA wellness.com.
There we go. Thanks. See you next time.
Thank you.